Welcome, everyone, to this episode of the Fired Up and Plugged In podcast, powered by Emergency Reporting. This is the podcast for all 21st century fire and EMS personnel. I'm Tom Lewis, Enterprise Training Manager and the podcast producer. Our topic today will be part 2 with our guest. We will be discussing the environmental factors that affect the physiological and mental health of the first responder. Our guest is Dr. Kristen Willeumier. Dr. Willeumier is a neuroscientist with expertise in neuroimaging and psychiatric disorders. She received Master's of Science degrees in Physiological Science and Neurobiology, as well as a PhD in Neurobiology from UCLA. She was a postdoctoral scientist in the Department of Neurology at Cedars-Sinai Medical Center, working in the field of neurodegenerative disease. She was the recipient of a fellowship award from the National Institute of Mental Health and has presented her work internationally. She is also the author of Biohack Your Brain, How to Boost Cognitive Health, Proficiency, and Power. Chief Brugman, it's all yours.
Well, good day, everyone, and welcome back to another session of Fired Up and Plugged In. And today is our second session with Dr. Kristen Willeumier, neuroscientist. And welcome back, Kristen.
Well, thank you so much for having me back, Chief. It's a pleasure to be here with you and Tom.
Well, thank you so much. You know, on the first podcast, we focused on many of the issues that our firefighters are having in respect to mental and physical health. And we kind of gave an overview of, some of the impacts and how that impacts us as individually. But, what are some of the ways that, what are some of the things that we can do today to minimize those impacts from a fire and emergency service standpoint?
Yes, I love this question because, toxic exposure, again, is sort of one of the number one things that firefighters face. So I'd like to jump in there. Let's talk about some of the ways to help mitigate toxic exposure from a sort of dietary and lifestyle standpoint. How does that sound?
Yeah, that sounds great.
Yeah, so number one, what I recommend for most people is to eat a Mediterranean but plant-based diet. So as we talked about, toxins can get stored in the brain, stored in cells in the brain. So what I want to do is make sure that you're eating foods that are high in antioxidants, and really sort of the number one foods are your green leafy vegetables and your berries. They're loaded with polyphenols and enzymes and vitamins and minerals. But these polyphenols really can go and cross the blood-brain barrier and provide antioxidant protection to the neurons in your brain. They literally protect the neurons from dying. So the more you can get 3 servings of green leafy vegetables and 2 servings of fruits a day, the better. I know Chief already knows this about me. An easy way to accomplish this is to have a fresh green juice daily. Now, I know this may not be the favorite of men, although I've worked with professional NFL players and I got most of my guys to start doing green juicing every day. But how easy is it to take 3 different kinds of green vegetables, a kale, celery, parsley, and add in, either a pear or an apple and have that in the morning. 16 ounces of a green juice. You're getting really clean nutrients. It's hydrating. So number one, I think that's really helpful. Number 2, I think it's really important to eat organic and non-GMO when possible. Again, because you're already exposed to all these environmental toxins, let's reduce those toxins that are coming into our body through our foods. Number 3, let's eliminate the artificial sweeteners and MSG. Again, just toxins in our diet. Let's not add that in. Let's take that out. And we'll talk a little bit more about this, but antioxidant support, you can do nutraceuticals like vitamin C, alpha lipoic acid, and acetylcysteine and curcumin. Those all will help protect your cells. I love drinking clean filtered water. So one of the best ways to help flush toxins out of the body is getting the fluids in. And most people don't really drink the proper amount of water each day. So for men, we want to get 3.7 liters of water in daily. For women, it's 2.7 liters. 20% of that can come from hydrating fruits and vegetables, but really that means about 3 liters for men. So I want you to be drinking that water throughout the day. Not only will it flush the toxins, but it will also help with your blood pressure. So that's a bonus, right? And I will also say we want to eliminate alcohol if possible. I know everybody likes to have a cocktail. If you have a healthy brain, by all means, you can have 1 to 2 cocktails, but really we want to reduce the burden on our liver, because our liver is our organ that's detoxifying our system. So if you can reduce your consumption of alcohol and even caffeine, because caffeine is a central nervous stimulant, I think all of those things would be helpful.
And you cover a lot of this in your new book, don't you?
I do. The new book, Biohack Your Brain, is everything that you can do to live a brain healthy lifestyle. And it was written based on the work that we did with our professional NFL players who, as you had talked about in the last podcast, right, struggle with traumatic brain injuries from repetitive subconcussive impacts and concussive impacts. And we showed that we were able to reverse brain damage in these players after a 6-month dietary and lifestyle intervention. And we were able to show this using conventional neuroimaging. So I love to tell people, listen, changing the brain is easier than you think, and you can rehabilitate it, even if you are a firefighter. So think about it. The brain is always going to be working to support you. It's just sometimes the things that we put into it are not serving us. So that's why I wanted to share, again, ways to sort of mitigate some of this toxic exposure. And one thing, 2 other things I think are really important. If I were in the fire and emergency service, I would want an air purifier in your home and even in the workspace. I mean, I don't know if this is possible, Chief. Talking to you now, would you have air purifiers in the fire stations?
No, I don't think in most of our stations we had air purifiers. It was very common in most of the houses that there were multiple fans always going.
Right.
Seemed like.
But would you do it? Would you do it now? Now understanding the importance of clean air, I think it's really, if I were in the fire service, I definitely have them in the home. We have them in every room in our home, but it would be wonderful to see air purifiers in the fire stations.
No, I totally agree. I think that's a minimal investment for the health of our personnel, and I would encourage every fire chief to make sure that they're doing that. I think that's just a very basic way to make sure that your environment is as clean as possible.
Exactly. So I love that one. And I think for anybody who's in the fire service and really wants to sort of take their brain health to the next level because of the exposure to all of the environmental toxins that we talked about in the last podcast, I like sauna therapy, either infrared therapy or going into a sauna to help support the detoxification of the body. It's easy to do, right?
Yeah, could you talk a little bit about that? Because I know that was there was some research done after 9/11 because they used sauna therapy to basically detoxify many of the folks that were on the pile for so long.
Yeah, I think it's really smart. I think this is a really easy way for the body to help eliminate toxins through the skin, just going into the sauna or even the infrared saunas.
So which one is better, the dry or the moist sauna?
I would really you want to do the infrared sauna. I think all of it will help, right? Because you're just supporting the detoxification, the elimination of the toxins through the skin. Important thing after going in is to drink plenty of fluids. So you've got your sauna, you've got your hydration, and you've got your green juicing and your clean air. All of those, I think, together collectively are going to help to support the detoxification process in the body.
Yeah. Yeah, I think it's really important. And I know some departments are actually beginning to install saunas in their stations. And it's part of their.
I would recommend it. I actually think that's incredible. I look at that as the equivalent of using hyperbaric oxygen chambers for our football players. So I know I talked a little bit about this at the ADAPT, or maybe I didn't bring it up in the ADAPT Summit, but for a lot of our football players who have traumatic brain injuries, one way to help reduce inflammation in the brain and to help grow new blood vessels in the brain is to go into a hyperbaric oxygen chamber. It's not technically used for traumatic brain injuries, but it's starting to be now because people are understanding it can be extraordinary in terms of reducing inflammation and healing the brain. So a lot of football teams are starting to get hyperbaric oxygen chambers, either at their facility, and the players are starting to realize how good it is for their health. I think the equivalent of that for the fire service is the saunas, having them either, the ability of the fire station to, cover the cost of, people being able to go into the sauna, or having one, like you said, attached to the fire station, I think it's just a smart strategy.
Yeah, I think it is too. I think anything that we can invest in that minimizes or helps to reduce the long-term exposures to our personnel and keep them as healthy as possible is a good investment.
It really is. And I think it's, again, when I'm thinking about toxic exposures, being so prevalent. Although last time I spoke with you, Chief, I don't know, you were saying, I don't know what the percentage of calls are not necessarily toxic exposures now. They're more medically related. Is that accurate?
Yeah, correct. I think from a national perspective, I think it's about 65% are medical. Actually, our fire calls have went down to about 4% of our total call volume, but yet we're still seeing a significant number of working fires. So it's not as if our fire problem has totally went away.
Sure.
It still exists, but in relation to the total volume of calls, which is actually went up quite a bit from where it was just 15 years ago. So
because you're taking more medically related calls as well, so it's increasing the volume, which is probably increasing the stress on the employees.
Oh, absolutely. It's and I think our calls have changed. When way back when I was on the line, if we saw a traumatic shooting or some type of a really significant event like we have seen in the past several weeks here in this country,
right?
That was an anomaly. Today, many of our firefighters are going out on shooting, stabbing, several opioid-related cases. Responding to people that find themselves homeless. I mean, the dynamic of the type of calls that we're responding to today has changed significantly, and I think that causes another level of stress today on our personnel that really didn't exist when many of us started. And I think we have to take
I was going to say, what are the current ways that people mitigate stress in the fire departments? Like, what are people doing now?
Well, I think we're really focused on, working out is a much bigger issue, which is a good thing. I think our firefighters are really focused, many of them, not all of them, but many of them are focused on eating better.
Good.
Than they used to be. But I still think that we have a long ways to go paramount in really developing a full package to say, if you're a first responder, here's your tool bag of things that you should be using, whether it's food, exercise, supplements, whatever, to minimize the impact on your brain and on your body.
Yeah, and as we're having these dialogues, especially you and I, because we have them all the time, I mean, I'm actually seeing a brain healthy firehouse and what that looks like. And that entails, some of the things we just talked about, from the foods that are there. I mean, of course, I would stock it and make it like have Mediterranean foods available and following a Mediterranean meal plan, and the juicing, as I talked about, having a juicer in every firehouse, and having the proper antioxidant support and supplement support, and having the air purifiers and the saunas, and having access to acupuncture, having access to people who do EMDR therapies, and sort of a good network of mental health providers that the station really likes, because I think there's a nice, you want to have a good rapport with somebody who could help you on the mental health side. And I think having as we talked about in the last podcast, the accessibility to allowing people to get their brain imaged if they want, having access to getting a sleep study done if they want. I can see it. I can see what it looks like, and I think it's going to lead to a happier, healthier fire service.
No, I agree. I think that the imaging piece is critical, and also the sleep piece. And again, it's somewhat of a mind shift, or I think especially for our senior leadership right now, to even think about doing that, because it's not cheap, as we know.
Sure.
I mean, neither is the loss of a life, or the impact on the individual if they have to retire early because they've contracted some significant ailment. So again, I think it's how we approach the issue.
Right, and the data is there showing that if you do routine sleep screenings within the fire service, you have I think it was a 46% decrease in disability days, because you are, and I think that's one positive step in the right direction, just sleep screening, to again rule out if there's sleep apnea issues and or insomnia. And we can address all of those. So even if you have to do shift work when you're off, let's help you to optimize your sleep in that period of time. And we can do that. And trust me, my dad, as I've talked about before, was a pilot for Pan American. So he flew internationally and then he was a firefighter at the same time. So he did that dual career. So talk about somebody who did not have a normal sleep schedule. Yeah. But the thing with my dad is, and maybe many people in the fire service just adapt. My dad, when his head hit the pillow, he'd just fall asleep. So he didn't really have an issue with falling asleep. But I think a lot of people do. And so that's an area where we can come in and make some corrections. So for those people who are shift workers who really have trouble with insomnia, there's certain nutraceuticals that you can take. There's certain things that you can do to help support the body before going to sleep. And, I've talked about them before, right? If you're going to sleep, no caffeine after 3 p.m. because it's got a half-life of 6 to 8 hours. So, don't drink alcohol, try not to have food 3 hours before you go to sleep. Keep the room cool, have the blackout shades, use white noise machine to reduce sounds if you can't handle the sounds. We've got the air purifier. So there's all these great little, what we call sleep hygiene hacks that people can do to at least improve the quality of sleep when they're home sleeping.
Yeah, I totally agree. We also, you touched on the whole supplement issue, and could you explore that a little bit? Because I know that In your book, you talk about the supplement offensive. And
yeah, the supplement offensive.
Balance your diet, right?
Absolutely. I have a whole chapter where I go into supplements. And the reason why I do that is when I was working at the Amen clinics, I was not only their director of clinical neuroimaging research, but I was also their director of nutrition and nutraceuticals. So one of my jobs was to show the efficacy of using nutritional supplements on changing brain function. And I had these great neuroimaging tools to show if you take this supplement, it actually makes a measurable change in brain function. And that's where the recommendations come from, the evidence-based science. So when it comes to nutraceuticals, the reason why I really like them, and what I find is, maybe in your 20s and 30s, you don't think about using them, but I always see this trajectory over time. People find as they reach 40, 50, 60 that nutraceuticals are really helpful in helping them to manage their quality of life. So, and as I said on the last podcast, because neurodegenerative diseases start 10 to 20 years in the brain before you have a symptom, let's make sure we correct nutritional deficiencies early and support our brain health early. So when it comes to just some basic supplements that I think everybody should take, and I go into this in the book, I have what I call the starting lineup. My top 3 are a multivitamin, multimineral. Anybody over the age of 40 should be taking one because the foundational nutrients that we need to make neurotransmitters decrease with age. Because, most of us aren't going out eating fresh, organic, whole, GMO-free, plant-based foods grown in, nutrient-rich soil. We tend to need a multivitamin to help support neurotransmitter production. So that's one of the basics. Number 2, I think everybody should be on an omega-3 fatty acid. In the clinical setting, we would measure omega-3 fatty acid levels in people. It's a blood test that you can do. And most people are woefully deficient unless they're eating at least 2 servings of fish per week, which most people are not, or they're supplementing with fish oil. So what we found is taking 1 to 2 grams of a fish oil that has EPA and DHA can help you to meet the needs of your brain and body for omega-3 fatty acids. Now, omega-3s are really important for your brain health. So they'll help manage your mood because omega-3s are what is composed of the cell membranes of your neurons. So the DHA component of omega-3 fatty acids go into the cell membranes, and they help the receptors for the neurotransmitters function more efficiently. So the receptors for serotonin, dopamine, norepinephrine will work more efficiently. That's why omega-3 fatty acids help with mood disorders. So if you're struggling with anxiety or depression, you definitely want to be on omega-3s. Also, they're wonderful anti-inflammatories. And given the high level of inflammation that most people's bodies have, and especially all of the inflammatory things that firefighters are exposed to, having the omega-3 fatty acids to reduce inflammation is also important. And it also, omega-3 fatty acids help to build brain volume and maintain brain volume as we age. So it's just a smart supplement to be on. Number 3, I think everybody needs to be on a vitamin D. As we've seen with the COVID pandemic, people are really starting to appreciate the importance of vitamin D in boosting immune function. But, coming from the brain health field, we found that people with low levels of vitamin D tend to be found in people with depression and Alzheimer's. So vitamin D helps in the pathway that increases serotonin levels in the brain. Serotonin is a neurotransmitter important in depression. So we want to make sure your vitamin D levels are optimized. If you don't go and get a blood test done to see where your vitamin D levels are at, most people could definitely use 2,000 international units. But more likely than not, you're probably going to need 5,000 to 10,000 international units to stay at what I would call an optimized level of vitamin D. So those are those are sort of my top 3 basics that I think everybody should be doing. There's a few others, like having a good probiotic is important. Curcumin is really important as well. Curcumin comes from turmeric, and curcumin is a great anti-inflammatory, so it actually helps to reduce inflammation in the brain. Why I love it is it can bind to the plaques that form in Alzheimer's disease and help to clear them away. So taking 500 milligrams of curcumin twice a day can be really great, not only for supporting your brain health, it can help improve mood and, again, reduce inflammation in the brain. So those are some of my top supplements.
Excellent. Excellent. Yeah, I think that's really, really good advice. And I know that, there's been kind of a sometimes mixed messaging on supplements because there are so many out there that are not good. And I think you pointed out when you're buying supplements, you should be looking for specific labeling to make sure that it's appropriate.
Yes. So, we laugh in the supplement industry. It's a little bit like the wild, wild west. You don't always know what you're getting. So some brands are more reputable than others. I like pure encapsulations. I like life extension. You can look to see on the label to make sure they're non-GMO, vegan, they don't have additives or fillers. There are certain standards that supplement manufacturers should have, like being produced in a GMP facility, good manufacturing processing facility. There are certain labels like NSF, National Sanitation Foundation, so they make sure that these supplements were made according to a proper sanitation standards. So, and I go into this a little bit more in the book, but yes, not all supplements are created equal. One thing that I tell people is when you're looking for supplements, I like to see if, there's evidence in the peer-reviewed literature that they actually work. Some supplement companies will have white papers, which show the experiments that have been done to show their efficacy on the brain or in the mood or whatever they're saying that they're going to be good for. The kind of supplements that we recommend, we've tested and published in the peer-reviewed literature. So that's why I tend to go with ones that have peer-reviewed publications attached to them. That eliminates the question of whether they're going to work or not. And one thing that I also tell people to do if they're looking for supplements is to see if they've been third-party tested. So have they been tested independently by another company to demonstrate that they're effective? So it's a lot to take in, but if you're really thoughtful in your approach to selecting supplements, they can be very helpful in supporting your brain health.
Yeah, I totally agree, and I think but I think that's important information because I've read many articles that many of the supplements that are sold have some pretty inappropriate product as part of their supplement.
They could have fillers that you don't want in there. I'll tell you, this from reading my book. My gosh, 25 years ago, I didn't really believe in supplements. I didn't think that they worked. I thought they were just expensive vitamins, that we excreted out of our body. And of course, over time, you become wise. And now that I've had the opportunity to work with them in the clinical setting, one of the reasons why I'm even involved in working with nutraceuticals is, so I worked in a clinical psychiatric setting where people typically had 3 to 4 psychiatric disorders, anxiety, depression, bipolar disorder, and we would utilize supplements as a way to help them to manage their moods instead of using medications, which tend to have side effects. So I became very interested in how supplements can effectively help us modulate our moods without needing to go to the medications. And I think that's where I really gained sort of a deeper love and appreciation of how effective they can be. And one thing that I want to share with people, and I do talk about this in the book, is sometimes it takes time for supplements to show their effects. If you're using them for mood issues, you tend to feel that right away, but sort of the longer term benefits that you might see from an omega-3 fatty acid or a multivitamin, those will work over the course of months, right? It takes at least 3 months to show those effects in, using neuroimaging. So be patient with them, find ones that you like. And what I tell people is work with a naturopath or a functional medicine practitioner if you want to know good brands, because this is what they do day in and day out. And it will take the guesswork out of, walking into the Whole Foods and just looking at the entire vitamin aisle and then asking the person who's stocking the shelves which supplement is best for them. So I always say, consult a reputable source or somebody who can help you in selecting, or reach out to me and I'm happy to guide you.
Okay, thank you very much. I think that's really, really important. Well, we're kind of bumping up on our time today, but any final thoughts that you'd like to share?
You know what? I just want to say it is truly such a pleasure to be here with you and Tom Lewis and connecting with those in the fire service and EMS. My father spent close to 3 decades in this profession, and I feel so connected with your community. And really, I just want to be here to help support you and support firefighters in the 21st century taking the best care of their brain and body health. So I'm here as a resource, and very proud to be part of this podcast and part of your network. And I think as a parting message, I hope people listen to this and are empowered to take some steps to take better care of their brain health.
Well, thank you, Dr. Willeumier, and I would suggest that everyone listening, if you want to get an in-depth tutorial on your brain and your health, pick up Dr. Willeumir's book, Biohack Your Brain, How to Boost Cognitive Health and Performance and Power. I've been through it twice, and it's extremely insightful. Well, it takes, as an old fire chief, you have to read twice to actually absorb all the information. So.
Oh, I'm honored. And a fire chief is in there, by the way. So I have every chapter has an NFL story and a client story, and I do talk about the fire chief. I wanted this book to be sort of a comprehensive guide, giving people the tools that they can use to take better care of their brain health. You don't need to come into the clinic and see us. These are all really accessible things. And hopefully I wrote it in a way that's really fun and engaging and practical.
No, you have. It's an excellent read, and I think I would just encourage every first responder to pick up a book and begin to, take some of the advice that you've given in it, because I think it's very, very relevant. So again, thanks for being with us on these podcasts and sharing your expertise, and I think it will make a difference in the lives of many, many first responders, and we thank you for that.
Well, thank you. It's truly an honor to be here, Chief. I really appreciate it.
Okay, thank you, and we'll talk soon.
Bye-bye.
Bye-bye.